And with me now is Dr. David Wohl, Infectious Disease Specialist at UNC Health. Dr. Wohl, thanks for taking the time to join us.
Thanks for having me, David.
So if you had been told back in February of last year that 500,000 more people would pass away from COVID-19, what would your reaction have been?
It's been hard to fathom and believe that we would lose 500,000 people in the next year. It would be the worst nightmare that we have as infectious disease specialists, that a pandemic had hit us that hard.
And so can you try and put into perspective how unique this past year has been?
It's, of course, for everyone across the country, if not the world, this has been a unique time, and nothing like this has happened before, or again, hopefully. But we've been impacted significantly in healthcare, where it seems like all hands have been on deck basically since the middle of March last year. And personally, I haven't worked this hard since I was a young intern spending nights in the hospital. This has just been a really incredible and heroic effort by very, very many committed people. We've seen some of the best we can ever expect from our healthcare providers.
Well, let's shift to some good news then. What impact will the Johnson & Johnson vaccine have on helping with some of the vaccine supply issues?
You know, already before we've even gotten our first dose of the Johnson & Johnson vaccine, we're seeing increased capacity. So we're going to have more vaccine to put into more people's arms. And the more vaccine that's out there, the fewer people will be in our ICUs and fewer people who will be like Ms. Harwood who die. So I think it's really, really important for us to think about the capacity that comes from the federal government and then goes to the states and then goes to our local clinics and vaccine centers. So this is really a game changer for us. We will definitely be able to vaccinate more people than ever before.
And it's my understanding that UNC Health is getting about 4,000 Johnson & Johnson doses this week. How do you go about determining who gets the Pfizer-Moderna shot and who gets the Johnson & Johnson shot?
We know that the Pfizer and Moderna shots are very, very similar. The innards of the two vaccines are identical. So there's really no reason to distinguish one versus the other. For the J&J or Johnson & Johnson vaccine, it's a different type of vaccine, and the data supporting it don't look exactly like the data for the Pfizer and Moderna shots. And so until we understand better how this works and if it is comparable, I understand that people have some reservations. On the other hand, it's a one shot, one and done, and seems absolutely protective against severe COVID-19 disease, hospitalization, and death, which is what matters to a lot of people. So there's a lot of folks who really want just that one shot of the J&J vaccine. So we're offering it in clinics that are dedicated to J&J, so people know when they come in that they're signing up for that particular vaccine.
And with the more vaccines, it seems that we see more and more restrictions that are being eased. This week, I don't know if you saw, but Texas announced they're rolling back all their restrictions. Do you believe we're at a point with this virus where that's a good idea?
No, I don't agree with Governor Abbott. I don't think that's a very good idea. And I unfortunately predict that there will be some surges in cases there. This is not the time to let down our guard. We're exactly where we want to be post the surge that we saw in November and December. We wanted to see those numbers go down. They have, but now we're at a plateau. We need to be hyper vigilant. This is the time when we can really push further to get to low levels of new cases, low levels of hospitalization that continue to drop, and lower levels of death. 1 out of about 700 people in the United States have died from COVID-19. This is not the time to pull back. Other countries have done that and seen massive surges.
And so final question for you, Doctor. I asked you earlier to look back. Now I'll ask you to look forward. What do you think the next year will be like as it relates to COVID-19?
It's up to us. It's up to our leaders. It's up to us as individuals to determine our fate. This is not just what's going to happen to us and we have no control. If we are more vigilant, if we take advantage of the declines that we've seen over the last few weeks, we can make a big difference. April could be better than March, and then June, July can be better than April. But if we pull back, if we open up bars and restaurants, if we drop our masks, we are going to be in big trouble. There's variants out there that are more catchy than the virus that's been predominating since last March. This is the time to really double down on our efforts that have really gotten us as far as we have. Schools are reopening, some businesses are reopening. That's great. But this is the time to really be careful and make sure we don't spread variant virus and that we don't spread the virus that can impact others and make them hospitalized and sick.
Dr. Wohl, thank you for your time. We appreciate your sleepless nights and all your hard work fighting this virus.
Thank you. Thanks for the attention.